after doing some checking and all. And this can be paid back to the finance company over a period of a year as EMIs by the patient or the relative. So instead of giving 2 lakhs at a go, which is not possible many times if a cardiac surgery is required, they can pay it in installments of maybe 20,000 or whatever it is over a period of 1 year. And the interest cost, we have said that we will bear it. The interest cost is not to the patient, it is on our account. So this is one way in which we wanted to help people who come to us. Now the next level is even people there are who can't afford even that. People can't afford even what I said. So how do we do that? That is where crowdfunding comes. In India, there are large amounts of crowdfunding platforms which raise funds for people who are in need and who don't have money. Just to give an example, there is a crowdfunding platform called Milar. There's another one called Impact Guru. And there is another one called Edu Dharma. This is just three I am mentioning. These are all crowdfunding platforms where if a patient requires 2 lakhs, 5 lakhs, 10 lakhs, 25 lakhs for a liver transplant maybe, you give your case, and if you prove that the patient can't afford and if it is a genuine case, this will go into the internet, and they have got large number of people who will contribute money into that, and within few days, surprisingly, a week, 2 weeks, this whole money is funded free of cost. So that is something where we have tied up. And the last but not least, there will be people who can't do any of these things, where our foundation will come, and wherever possible, whatever possible to us, we will be giving them help for subsidized or free treatment. So this is what I wanted to tell, that we have now decided that we have to make sure that people who come to us, if there is a bed available, if there is a facility available, we will see that how we can help them. Just wanted to give you this as an opening piece, and regarding the hospital, Alisha and Sharbaz will speak to you.
Thank you very much, sir. May I now call upon Ms. Alisha Mubin, Executive Director and CEO of Astro and Medcare Hospitals and Clinics, GCC, to say a few words.
Thank you. Thank you, Chairman, for giving us a background on where we started our journey as Astro DM Healthcare, which was born out of UAE, and where we reach now. And he always says that the reason we are where we are is because of where we started. And I think there's a lot that goes from having been born in UAE, and especially in Dubai. So if you now look at our journey in UAE, this is our 6th hospital here in UAE. This is our 2nd hospital under the Asta brand. We have the 4 other hospitals under Medcare, and this is the 2nd one, which actually takes it to a combined strength of 600 beds in UAE. So that's both the Medcare and the Asta together. Our chairman spoke a lot about the problems which comes as far as delivering healthcare and the cost that's involved in getting good quality healthcare, especially in India. And of course, the government is doing a lot in terms of trying to alleviate that. If you sort of compare it to what the government in UAE has done in the last 5 years, it's been phenomenal. Since the inception and implementation of mandatory insurance, the access to good quality healthcare that everyone can have now is finally implemented to each and every single person who reside in this community and this society, which is a huge milestone and a huge leap for human welfare in this country, because you have almost 85 to 90% of the residents in the city are expats. And a lot of times the cost of healthcare is so exorbitant, people have to wait to go back to their home countries and sort of put their health aside. And now we can say very happily and very proudly that we live in a country which has taken a huge amount of effort to make sure that healthcare is available for each and everyone. And we are very happy and very proud to be part of this journey along with Dubai and along with UAE. And that is entirely the reason that we have been kind of continuing our growth in terms of building more and more hospitals. So if you look at Dubai and the urbanization of the city, you've seen the residential developments moving out, and now you can't really say this is the hub of Dubai. It started with Dubai, maybe there, and now it's sort of spread across so many, such a wider kind of radius. And we've decided that we want to be closer to the people. So while we have that primary care network and the clinics and the pharmacies which are closer to you, we thought that it's important that we have the tertiary care facilities also available closer to you. So this 150-bed hospital that we are very proud to launch today will be exactly that. Something closer to the community of Gises and the people in this locality that will be able to serve the best quality care with the best service as well. Our promise statement, if you look at it, is very simple. It says, we'll treat you well. I think it goes a long way, and it goes very much in tandem to what Dubai also tries to talk about, creating happy, healthy societies. And I think you cannot talk about being happy unless you have good health. So if you actually look at a lot of the killers right now in this market, we're talking about mainly cardiovascular diseases, we're talking about cancer, and we're talking about respiratory diseases. Gone are the days of infectious diseases, whereas it has become more now the lifestyle diseases that we need to take care. So the requirement for more tertiary care facilities has become there's an acute shortage of tertiary care beds, especially in some of these areas, and that is what we are trying to fulfill with this hospital. So whilst it is a general specialty hospital, there is a certain focus on the areas which the DHA themselves have earmarked and said is a requirement. If you look at when you talk about the lifestyle diseases, it's actually quite alarming with some of the statistics in UAE. The number of people who are overweight in UAE is 34%. If you compare it to, for example, in Japan, it's 3.5%. When you look at the smoking population in UAE, it's 22%, which is again extremely high. So I think when you compare it to the diseases that are coming because of this, it goes hand in hand. So there's a huge requirement for a lot more community engagement. It is a huge requirement for people to take their health back, because these are things which we have a control on. So we take a lot of pride in being able to take care of people. Our campaign and we are very proud to say that we've been treating 200 nationalities over the last 30 years. And that is because we live in a city like Dubai. We have large number of facilities here in UAE, and which allows us to treat a large number of nationalities from all over the world. And we are very proud of being part of His Highness Sheikh Mohammed's vision and what he talks about, the year of tolerance. We live in this microcosm of society where everybody is living well together, happily and healthily. And this year being the year of tolerance, they say that, we take care of each other. And we have to look after each other. I think one of the messages we would like to say as Aster is, we take care of others, but it's also so important for us to take care of ourselves. A lot of these things that are happening to us right now as far as health is concerned is because we don't look after each other. They're all slow killers which are coming in. So I hope that we'll be able to support you as and when there is a need. But at the end of the day, I think the health remains mostly in your hands, and we are there as Aster to be partners in your healthcare journey every step of the way. I'll now request Dr. Sharbaz to give us a little bit more details about the hospital.
Good morning. Thank you so much for coming, and the media has been always great support for us. This is a 150-bedded hospital. As Alicia mentioned, we have a hospital in Mankul, which is going over full. The occupancy was very high. So what we were looking at is, we were just watching the crowd which is coming. It is more from Sharjah, Ajman, and would say bedroom of Dubai, this area of Dubai. So it mandated us to have a hospital here. So what we have done is, we have planned to move from a tertiary level to a quaternary level, tertiary and quaternary level, by leveraging our strength in India. So as you all know, our footprints are very loud and clear in India. We have big facilities like MedCities. So we have licensed all those doctors here, so that all complicated cases which comes here need not get shifted back to India. One of the problem what expats face is, especially critical cases when they come in, and when the patient becomes critical, transportation becomes very difficult. Air ambulance is very costly, and then taking in airlines, a lot of restrictions. So there was a huge struggle on that grounds. So with this hospital coming up with a larger facility, things will be much solved on that grounds. And like just to echo what Chairman said, we've always been focusing on patient and patient care, and we've put patient and patient care on top of our pyramid. And we believe that when we concentrate on patient and patient care, the profit just flows. And this Mankul is the best example for it. And with regards to the doctor selection, most of the doctors come from our hospitals back in India. So we know their credentials, we know them very well before even joining us here. So I think this hospital will be a great help for the people in Northern Emirates and Nahda and all this part of Dubai. So once again, I thank everyone, the media especially, because you catch a lot of our good stories, I would say, which has been a lot of stories in terms of critical case managed here, and it comes as media news. Thank you so much for all your support as always. Thank you.
Thank you very much, sir. Thank you, ma'am. Dr. Sharbaz, I would now request you to kindly hand over a small token of our appreciation to our chairman.
Yeah, please.
Good morning. I'm Monica from the Gulf later. You mentioned about the growing populations in Sharjah and the Northern Emirates, and I know that you have expansion plans within 3 to 5 years. When are you going to get to Sharjah and the Northern Emirates?
Yeah. So we are very happy to announce that, as you know, we already started a Medcare hospital in Sharjah last year. So we are starting an Astr hospital in Sharjah, which construction is already started, and we should be able to launch it next year. Middle of next year, we should be able to launch the Astr hospital in Sharjah.
How many beds will that
So we are present by way of not hospitals but clinics and pharmacies in all the Emirates. Hospitals, if you look at the requirement for hospitals may not be there in some of the Emirates, because already there are hospitals which are sufficiently. Some places there's no point in going and doing it again. So we are looking at opportunities, and we want to be there wherever there is a requirement.
I'm Suchitra from Gulf.
Yeah.
One, the Astro Hospital that's coming up in Sharjah, how many beds would that be?
Yeah.
That's one question.
How many beds? Yeah. This is about 100-bed hospital. 100-bed hospital in Sharjah.
And the affordable care access under the Access brand, which is coming up in Sonapur,
Yeah.
when is that going to happen, and how many beds is that going
Yeah.
to be?
So that's a question which I just wanted to, in fact, I didn't touch upon that. As we were telling earlier, we have only clinics under the Access brand for the blue collar workers. But we are starting a hospital which can cater to the blue collar workers in Muhasina, in Sonapur, which will be in the ward format and which can actually cater to the lower income group. That's a big requirement. If you look at the statistics, it is staggering, because the upper segment of the pyramid is very thickly populated with hospitals beds, whereas when you go down, the number of hospital beds are very low. So the people in the lower segment, there's a requirement for more of beds in that segment. So we are slowly trying to get beds into that. What we have now are clinics mainly in that, and there's a requirement for more beds, and we are looking at that. So various things we are looking at. We have recently, in the stage of acquiring a hospital in the Jebel Ali area, where again we think that there is a potential for providing service for such patients. So we are aware that there's a requirement in that stage. And answering your question, we hope that in the next 6 months we'll be able to inaugurate that hospital.
60 beds.
That will be, bed number will be 45. 45. Yeah. We have significant expansion plan, as I mentioned. In fact, in the next 2 months, we are going to inaugurate 2 hospitals in India. One in Bangalore, which is called the Astr RV Hospital, which is in the JP Nagar in Bangalore. That's the second hospital in Bangalore. CMI is the first hospital, this is the second hospital. So this is a 250-bed hospital which is in JP Nagar, close to Jayanagar. The other hospital which will be inaugurated soon, within the next 2 months again, we will be doing the soft launch within 1 month, is at Kannur. Yeah, at Kannur at Chala, we are building a 300-bed hospital, which is already in the later stage of construction, and with the airport and all coming, and Kannur not having a good hospital so far, we are looking at starting that hospital within next 2 or 3 months. So there are 2 hospitals already in pipeline which will be started soon, and the other hospital which we have started construction, which will take 2.5 years, is a large hospital at Chennai. This is a 500-bed hospital which we have already acquired the land, and the construction planning is happening. That will be about 500 beds, but that will take 2.5 years.
Hello, my name is Hassan from Hawaii TV channel here in Dubai. First, I would like to congratulate for the opening.
Thank you.
And I'm very happy to attend this event today. I would like to ask about first, as you know, the cost of the healthcare in Dubai or in UAE in general, it's high. That's why most of the people, they are preferring to check in their country, back to the country. How you can make level between good healthcare with a little cost? This is first question. Second question about the Expo 2020. My vision is longer than UAE. So Esther as a big group, do you think it will be a good chance to increase your marketing out of the Middle East, out of the, it will be a good chance, 6 months and business from everywhere. So do you have planning for that?
Yeah. So answering your first question, I think that this issue of healthcare being very expensive in UAE has come down significantly with what Alisha mentioned, because there is a universal health coverage. Everybody is covered, and there may be a difference to the ambience of the hospital to which you are going, but you are given the care starting from emergency care to the the best possible care. So I don't think affordability is an issue or cost is an issue, and cost now is controlled by the insurance companies. They look at how the cost can be brought down, and they reduce the rates as much as possible. And the government also doesn't allow to increase the cost by the healthcare providers. Only according to the inflation it is being allowed. So cost no more is a big issue. I'm not saying that's not an issue at all. The issue of not having sufficient expertise here is slowly getting addressed. Like earlier when we were having hospital, we were having just deliveries, small surgeries and all. Now we do everything. We do angioplasty, cardiac surgery, we do all the complicated things here because there is somebody to pay for that. So there is a huge improvement in the health quality delivery in UAE. And regarding the second part, definitely we look at the opportunity to go beyond UAE, and Expo will be a good opportunity where we can showcase ourselves, and we will be definitely looking at opportunities to go to other places. Thank you.